And in the bill to continue Montana's Medicaid expansion program, one of the program's biggest financial beneficiaries, hospitals, are paying a new tax to help support it.
But as MTN's Mike Dennison reports, the bill also provides tens of millions of dollars of revenue for hospitals as well.
If the bill to continue Medicaid expansion in Montana becomes law in its current form, hospitals in the state will pay a 0.875% tax on outpatient services. That tax generates $30 million over the next 2 years to pay at least half of the state's 10% share of program costs.
It's going to support $300 million of health care benefits over the course of the next 2 years. And that's benefits to all of the medical providers who deliver services.
But that's only half of the tax's revenue. The other half, through a fund matching process involving the state and federal governments, generates an additional $100 million a year for the hospitals. The bill from Republican Representative Ed Buttrey also increases something called the hospital bed tax, which almost all Montana hospitals pay. In turn, that tax, using the same matching process, creates another $200 million a year for Montana hospitals. But Olson and Buttrey say this revenue is not a windfall. They say it helps hospitals offset the cost of treating so many additional patients covered by Medicaid, whose reimbursement amounts don't cover hospital costs of providing the service.
Remember, anything that's below the cost of the service provided that they get reimbursed gets cost shifted to folks that have insurance policies and self-pay. So this is not a tack by the hospitals to get rich. This is a tack to help them pay for the services that they have to provide.
This tax revenue generated for the hospitals through Medicaid expansion comes on top of more than $500 million hospitals have been paid in the last 3 years for patients covered by the program. Olson says that money has meant less bad debt, less charity care at the hospitals, stable prices, and more services from hospitals.
We have a number of hospitals that have not raised their rates in the last 2 or 3 years. We have a number of hospitals that have been able to provide additional services.
That's what lawmakers will decide as they debate this issue. Is this huge overall investment in the healthcare system by taxpayers and hospitals worth the return? Reporting from the Capitol, Mike Dennison, MTN News.
The Montana House is scheduled to debate and vote on the Medicaid expansion bill on Friday.